Hello, I'm Tony DeMaria, the editor of JACC, here with some of the highlights from our August 7th issue. The first issue I'd like to tell you about is a paper on TAVI and specifically conduction defects following the TAVR procedure. And we know that AV conduction abnormalities are very common following TAVR. In fact, have been reported in up to 40% of patients. However, the effect of these conduction defects, particularly heart block, and the effect of pacemaker implantation of the overall outcome of TAVR remains uncertain. So 2 European institutions with a lot of experience in TAVR pooled their data to study this problem. They divided their patients into 3 groups: those patients who needed a new pacemaker following TAVR, those patients who already had an existing pacemaker, and those patients who neither had an existing pacemaker nor needed one. And so what they found out was that, in fact, the 12-month total mortality, which was the primary endpoint of this study, was exactly the same in all 3 groups. So in fact, there really was no effect of pacemaker implantation on the overall mortality of these TAVR patients. Now, there are, of course, a number of caveats. Most of the patients received Medtronic self-expanding stents and valves. So in fact, this may not pertain to all patients undergoing TAVR. And of great importance, this study really was totally underpowered to yield a definitive answer. Nevertheless, at this point in time, it's very, very encouraging to see that if our patients undergoing TAVR do require pacemaker therapy, that their outcome should remain unaltered. An interesting paper in JACC deals with the issue of HDL cholesterol and why it's been that despite the ability to show an inverse correlation with cardiovascular risk, therapy of HDL has not been very effective. And in this particular study, the investigators compared the concentration of HDL cholesterol with the concentration of HDL particles. Now, they subsequently corrected these concentrations for their interaction with each other and with other atherogenic lipoproteins, including LDL cholesterol and LDL particles. And they did this in over 5,500 individuals that were followed in the MESA trial. And the endpoints were to look at carotid intimal-medial thickening and to also look at overall cardiovascular events, myocardial infarction and death. And what was found, interestingly enough, is both HDL cholesterol and HDL particle concentration do in fact have an inverse correlation with both CIMT and events. However, when you adjust these concentrations for other atherogenic lipoproteins and each other, in fact, only HDL particle concentration remains significant, having a hazard ratio of 0.22 for CIMT and 0.75 for overall events. And so this is very interesting information for us, and it really raises the possibility that in the future we should depend on HDL particle concentration, more importantly than overall cholesterol concentration, in assessing overall cardiovascular risk. A cute paper in this issue of JACC deals with left atrial appendage morphology and the risk for systemic emboli, particularly stroke, in patients with atrial fibrillation. And specifically what these investigators did was examine the relationship between the morphology of the left atrial appendage and the risk for stroke. And in a very colorful fashion, They described the morphology of the left atrial appendage variously as chicken wing or cactus-shaped or windsock-shaped or even cauliflower. And the important take-home message from this study was that a certain morphology described as chicken wing, which in fact was represented by a bend in the proximal or mid-portion of the major lobe of the left atrial appendage, correlated very closely with a reduced likelihood of stroke from atrial fibrillation. In fact, a 79% reduction in the risk of stroke and atrial fibrillation. So all of us are going to have to get used to assessing the morphology of the left atrial appendage, but these data may be of significant importance in deciding the optimal risk for many of our patients. For Inside JACC, I'm Tony DeMaria.